Greetings, good morning. I want to talk to you about a technique that I use a lot in my consultations to help my patients memorize and retain a summary image of the consultation. I am going to talk to you about visual thinking. Visual thinking is a methodology with graphic expression techniques that allow, through simple drawing and the support of writing and words, our patients to fix a summary of the session in their memory and then easily explain to themselves and others what happened during the consultation. Additionally, it allows them to photograph it and take an image on their phone of what I have described so they can explain it to others or remember it themselves. For this, I will need to have colored markers, pens, and a whiteboard, a chalkboard. And if I don't have that, I can use large paper placed on the wall to work on. Now I will explain how I do it. To continue with the idea of visual thinking, I will give you an example. Let's say my patient presents, for example, candidiasis. And in this chart that I have organized with the date, evaluation data, drawing, and treatment, in this chart, I will note that my patient has candidiasis. Candida. Okay, I am going to explain some of the general symptoms of candidiasis. For example, anxiety, melancholy, sometimes depression. Iron deficiency is common. Gases. And gas from inflammation. Need for solitude, etc. Well, I provide this information to my patient. I explain that candidiasis is caused by a yeast. A yeast, which is a microorganism. That lives in our intestine and is part of the intestinal flora, and that it has a shape like little balls, like small eggs, and it does what yeast do, they produce them. But in addition, I explain. Yeasts, Candida, have a biological function to capture and eliminate decomposing proteins that reach the intestine. For example, you eat a piece of meat or egg that is slightly past its date and is somewhat decomposed. Candida captures those proteins when they reach the intestine and sends them through the feces to the toilet. And it has another function that is very interesting, and that is that they capture heavy metal molecules. Look, it causes iron deficiency because when there is an excess of Candida yeast in the intestine, they trap excessively all the heavy metals that arrive and also the iron molecules. That's why it's common for it to cause an iron deficiency or anemia. I actively test my patient and they tell me they have Candida in, for example, the eyes, in the intestines, and in the genitals, for example. So, I'm going to make a little drawing that This is the esophagus, the hiatus, the stomach, and the small intestine, and the large intestine. Here, the appendix, the ascending colon, the transverse colon, the descending colon, and the rectum. In the intestine, in both intestines, there is an infection due to an excess of candida, which is called candidiasis. And I draw also that there is an infection in the genital area like this. If it is a woman, I draw that she has it in the genital area, probably in the ovaries, in the tubes, and in the uterus. And I tell her that the candida is distributed throughout all the intestines. Although in plates, they are not a single yeast, but they are in plates. They appear around there. And produces the inflammatory effect, which is very important in the entire intestine. It may happen that the inflammation of the intestine generates an upward pressure, and that when it presses the stomach, this leads to a hiatal hernia. This is a possibility. But what is certain is that the intestine is inflamed, full of bases and causing this type of symptomatology. Look, how interesting. Probably my patient understands better if I draw myself. A small piece of intestine, so that they understand what I'm going to explain now. Like, well, let's say this is a piece of intestine that I have taken from here. And that the inside of the intestine is lined with intestinal mucosa, which is something like a gelatinous greenish substance. Where the candida plaques are, we can draw it like this for our patient, so they can understand that they have an infectious state and see it in more detail. And now look, how interesting. Candidiasis produces many effects on the emotional scene. It causes many alterations in emotions and feelings. Notice what happens when we have candidiasis in the intestine. It turns out, in the intestinal wall, in the intestinal mucosa, there are small glands that are this, located in the intestinal wall. They are glandular corpuscles that are glands, tiny, they emit hormones. Notice how very interesting and fascinating what these glands emit. Serotonin, tryptophan, endorphins, dopamines. Let's see. 1. Separates dopamines, and others. But look at these, how interesting. Serotonins, endorphins, and dopamines are directly linked to mood. You already know that endorphins are the happiness ones. Tryptophan helps to calm down and sleep better. Dopamines help not to feel pain and perceive the quality and sensation of a good life. These hormones are produced by these corpuscles. What? When the intestinal wall becomes inflamed, it swells outward, but also inward. It's a phenomenon similar to when I hit my eye and it swells and closes. Something like that. It turns out that when they swell inward, they stop producing hormones. These hormones, serotonin, tryptophan, endorphins, dopamines, I explain this to my patient and draw it for them in such a way that if I have told them you have a chlamydia infection that causes you anxiety, the iron deficiency or anemia causes you anxiety. The deficiency of these hormones causes you anxiety. You stop perceiving quality of life, pleasure, well-being, and you start feeling anxiety. Feeling more pain because dopamine levels have significantly decreased. I remind them that this is not the only source of these hormones, as the pituitary gland and the thyroid also produce these hormones. But in the intestine, a noticeable candida is produced that moves from the intestine to the bloodstream and eventually affects the entire body. This is how I explain to my patient their intestinal candidiasis. I explain their vaginal candidiasis in the uterus, in the ovaries, etc. And I tell them that when they have candidiasis in the genitals, they will have, for sure, a very low libido. For sure. Their sexual desire will be greatly reduced. It's a biological mechanism. When there is an infection in the eggs, in the ovaries, in the uterus, biology greatly suppresses sexual desire. Libido diminishes significantly, also due to hormonal issues. And it does so to prevent an egg from being released infected with candidiasis, or a sperm from having to travel through infected tubes. And when it merges with the egg, both are infected. And it is more likely to result in a defective fetus. So biology has structured all of this. I have already told you that one of the keys to the inflammatory state, what we call intestinal dysbiosis, is that since it is a yeast, it produces gases and causes inflammation. This is the idea. Now I would explain the treatment to my patient. I would suggest quantum remedies. For example, number 9, number 2, which is anti-inflammatory, and number 52, which is an anti-infectious booster, and those that come up in the testing. I would propose the diet for Candida. And if necessary, I would check their pH levels, which are often very acidic. The acidic pH, I would explain it to them and suggest that they probably drink lemonade with baking soda. Well, how many days? Well, I would test it, but for example, 8 days, a tablespoon of quantum remedy 3 times a day. And I would also test if they have a partner, if they have pets. And I would tell them, I would test if they need to come back. Now I would ask my patient to take a picture of this and to save it and take it with them. When they forget or want to review the session, they just need to look at their picture. Additionally, I will prepare a report with my name, my details, my profession, my location, my phone number, and where I include my patient's information. And all of this explained textually. The result is they have had a consultation, I have explained things verbally, I have written it down, I have drawn it, and I have reinforced it with the treatment and all the instructions. Thus, turns out that our patients leave delighted by the good treatment, informed by the professional attitude. And if they want to return, they will come back happy to a place where they are treated well as well. Additionally, they will speak very well of us. This has nothing to do with a treatment done in a conventional medical center and how people are usually treated. This is something that makes a difference, that makes us high-quality professionals with very good benefits and excellent service for our patients, and that the growing prestige we are gaining more and more is justified. So get going, learn a bit of basic drawing. You see that I don't have to do anything too sophisticated. Visual thinking is based on minimalist things, on simple but graphic ideas. I mean, you don't have to be an expert in anatomy and draw a perfect stomach, but the idea, yes. The image, yes. Sending you a kiss.